Back by popular demand, Cathy Bennett, President and CEO, New Jersey Hospital Association. Good to see you, Cathy.
Good to see you again, Steve.
It's been too long. We will have you on again real soon. But right now, I want to talk about, as we do this program in the middle of November 2023, be seeing later, the nursing crisis in our state and nation. How bad is it, and what's the impact on hospitals?
The nursing shortage, as you know, it's a challenge, and it's one that's impacting healthcare systems and facilities across the country. We're all facing it, and it's especially prevalent in New Jersey right now, as we're predicted to have a shortfall of 11,000 nurses by 2030. That's the third largest shortfall in the nation.
You know, we've talked to a lot of higher ed leaders, and higher ed's changing on so many levels out of necessity, right? The need is there. What's the role of higher education as it relates to this nursing crisis?
The role is critical. As you know, we need to make sure that we have an education system, that has the resources they need to stand up, the courses that students want to enroll in here in New Jersey. We have a lot of people that apply to nursing school, and the nursing schools here simply can't accept them because they don't have enough educators.
Let me try this. There's a lot of debate and confusion around nursing ratios, nursing and patient ratios. The economics of hospitals are what they are, and we're underwritten by a variety of different hospitals, all not-for-profit, because hospitals are not-for-profit in the state. Is there any standard as to what that should be, the patient to nurse ratio?
So our hospitals, Steve, use established metrics and professional judgment to provide safe staffing for patients. Rigid ratios themselves, they impede best practices in care delivery. They discourage innovation, and they dilute the real-time clinical judgment and flexibility that our care teams need.
I just mentioned the economics, if you will, of hospitals. And we've had this discussion in the past, but I want to revisit it. To what degree, from your perspective, and the Hospital Association represents a large percentage of the hospitals in the state of New Jersey, correct?
We represent all of the acute care hospitals, correct?
All of them?
Yes.
Do we have, quote, too many hospitals in New Jersey?
We do not have too many hospitals in New Jersey, Steve. The hospitals we have are integral parts of their communities. They're the anchors, providing jobs, providing resources, providing, community health benefits. And as we saw through COVID, and as we've seen as we come out of COVID, our hospitals are the place that all of our community members can go to, regardless of ability to pay, 24/7, and get treatment and ongoing care.
Cathy, from your perspective, you mentioned the pandemic. How do you believe COVID has changed hospitals and delivery of healthcare in hospitals forever because of COVID?
I believe some of the things we've seen are that innovations like telehealth and remote patient monitoring have allowed hospitals and allowed their team members to do jobs from beyond the four walls of the hospital. And that's something that has allowed us to really meet patients where they're at and where they can have care in the most accessible way.
As COVID was at its peak, 2020, moving into 2021, you remember, as I do, and you're much closer to it than I am, Cathy, the celebrations, the honoring, the recognizing of those on the front lines, our healthcare leaders, physicians, nurses, respiratory therapists, those who held the hands of patients as they tried to talk to their family members via FaceTime, and many of them passed tragically. Fast forward, whole range of hospital professionals, people who work in hospitals, are concerned not only that their public sentiment has shifted, but they are now targets of certain people who see them as some sort of enemy in this public health debate around all kinds of all kinds of issues. How the heck did hospital professionals get on the wrong end of this?
I think what we saw emerge, even during the pandemic, as we were coming to the tail end, there's a lot of frustration from the public that wanted to be, back out in public, did not want a mask, and, wanted to interact. They wanted their kids back in schools. And because hospitals were so key, hospitals were doing all the testing. That's where you went to for treatment. Hospitals were standing up the vaccination sites in the communities. The issues that people felt about COVID, they started to conflate with hospitals.
So hospital professionals are trying to provide community health services to people in the community, and they're on the wrong end of frustration.
I think that that's really what we're saying, wrong end of frustration, that's just bubbled over. And what we've seen is, a public that wants things to be back to normal. And so, part of this is that, the hospitals were conflated with this thing that didn't feel normal. And when we look back over what those 3 years looked like, let's be honest, it was dealt with uncertainty, inability to get testing out because of where we were nationally, and then we turned the corner and there was still masking going on, and people wanted to go back out and they wanted to have a good time, and they were hearing that part of the reason is we weren't quite over it. And when hospitals are at where the public is at now, we are in an endemic state. We deal with surges as they come up, but we make sure the public is safe. But again, we're back to our business of quality, equitable care for all.
Cathy Bennett, President and CEO of New Jersey Hospital Association. Thank you, Cathy. We appreciate it.
Thanks so much, Steve.
You got it. I'm Steve Adubato. Make sure you join us next time. See you then.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating 30 years in public broadcasting. Funding has been provided by New Jersey Institute of Technology, PSEG Foundation, Community Food Bank of New Jersey, New Jersey's Clean Energy Program, New Brunswick Development Corporation, PNC Foundation, Robert Wood Johnson Foundation, the Fidelco Group, and by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber and by NJ Biz.
At the Community Food Bank of New Jersey,
we are working
now more than ever
to fill the emptiness caused by hunger.
We are the state's largest anti-hunger organization.
And together with our 800+ community partners,
we are committed to delivering food,
help,
and hope
to our hundreds and thousands of neighbors in need.